Bismillahirrahmanirrahim. A 19-year-old woman, gravida 1 para 0 at 39 week of gestation, come to the hospital due to an increasing nausea and vomiting. The nausea began after dinner last night and has progressively worsened. Over the past few hours, she has had 2 episodes of vomiting and constant lower abdominal pain. The patient has had constant clear vaginal discharge over the past 2 days and intermittent vaginal spotting. She reported urinary frequency throughout the pregnancy but no dysuria or hematuria. The patient was treated for chlamydia trachomatis infection in the first trimester. Her third trimester chlamydia trachomatis screen was negative. She has no chronic medical condition and has no surgeries. Temperature is 39. Blood pressure is 120/68. Pulse is 100 per minute. The abdomen is not tender with no rebound or guarding. There is diffuse uterine tenderness. The cervix is 2 cm dilated and nitrogen positive clear fluid is pooled in the posterior fornix. Fetal heart monitoring show a rate of 165 per minute. Moderate variability and no acceleration or deceleration. Tachometry show contraction every 10 minutes. Laboratory results are as follows. Hemoglobin 10.2 gram per deciliter. Platelets 198,000. Leukocytes 18,000. Neutrophil 68%. Lymphocyte 14%. Which of the following is the most likely diagnosis in this patient? So first of all we have to see that as I told you that there is always a hint in the question. So first of all we have to search the hint, that where is that hint. So the patient is suffering from vomiting. So the patient is suffering from vomiting. So we can highlight this one, nausea and vomiting. This is nausea and vomiting. This is the first hint. The second hint is that the patient temperature is 39.103 Fahrenheit. This is the second hint. And the third hint is that there is diffuse uterine tenderness. The first hint is the patient is suffering from vomiting. The second one is that the patient temperature is raised 39.4 centigrade. The third one is that there is a diffuse uterine tenderness. And the fourth one is leukocytosis. See, leukocytosis. So based on the first of all, let's revise again. So the first hint is nausea. The patient is suffering from nausea and vomiting. This is the first hint to the diagnosis. The second hint is temperature is equal to 39.4 centigrade. This is the second hint. The third hint is that there is the uterine tenderness present. Uterine tenderness. And the fourth hint, leukocytosis, 18,500. Leukocytosis. So these are the 4 hints to this question diagnosis. So based on this 4 hint, what is the diagnosis of this question? So this is probably chorioamnionitis, also known as intra-abdominal infection. So the choice D is the correct one. Intra-amniotic infection, also known as chorioamnionitis. So patient with intra-amniotic infection, also known as chorioamnionitis, typically have nausea, vomiting, and uterine fundal tenderness. As I told you, that this patient is also suffering from the vomiting. Her temperature is rise, and also she have uterine fundal tenderness, and also the patient is suffering from leukocytosis. The WBC count is raised 18,500. The diagnosis of intra-amniotic infection is based on the presence of maternal fever plus at least one of the following: fetal tachycardia more than 160 per minute for at least 10 minutes, maternal leukocytosis, maternal tachycardia, or purulent amniotic fluid. And I forgot one thing. There is also the another hint. The another hint we can see that the patient, the fetal heart rate is 165 per minute. This is the fifth hint. So fifth hint, I forgotten. Fetal heart rate is equal to 165 per minute. 165 per minute. So these five are the hint for the diagnosis of this patient. And what is diagnosis of this patient based on these five hints? The diagnosis of this patient is intra-amniotic infection, chorioamnionitis. Okay, so let's come to the incorrect one. Why the abruptio placentia is incorrect? Why abruptio placenta is incorrect? Because premature rupture of membrane increases the risk of abruptio placentia, and there is no any such history of premature rupture of the membrane. The second one is acute appendicitis. So acute appendicitis typically present with acute onset of fever, nausea, anorexia, and the right lower quadrant pain. This is acute. This is for the acute appendicitis. The third one is chlamydia cervicitis. So chlamydia cervicitis present with purulent cervical discharge. There is no associated uterine tenderness. The choice E, pelvic inflammatory disease. So PID or pelvic inflammatory disease is an ascending infection, uncommon during the third trimester of the pregnancy. The choice F, viral gastroenteritis. As we know that viral gastroenteritis present commonly as acute onset diarrheal illness, and this patient is not suffering from any diarrheal illness. So let's revise again. Choice D, intra-amniotic infection or chorioamnionitis. So first of all, for the diagnosis of intra-amniotic infection, we have the following in the question. The first one is that the patient is suffering from nausea. This is the first, nausea, vomiting. The second option is that the patient temperature is raised. Patient temperature is raised. The third option is leukocytosis. Leukocytosis. This is the third hint. The fourth hint is the fetal heart rate is more than fetal